17-year-old Brianna Wong knows all about concussions.
I had symptoms for about a week and a bit, which was blurred vision. I had migraines. It was pretty bad.
Under new Institute of Sport guidelines, if she was concussed again, she'd have to sit out her sport for at least 3 weeks and be free of symptoms for 2 weeks before she could start contact training.
I think it's an amazing idea. With this now, you have a structure to follow and you know how long you're going to be out for. You know what the protocol is when it happens.
We're unashamed in having a real focus on youth and community sport because that's where there's an absence of healthcare practitioners. That's where 95% of concussions happen.
The AIS developed the guidelines with colleagues in Australia, New Zealand and the UK.
The best way to protect the health and well-being of athletes at the youth and community level is to have one set of guidelines that everybody follows so there's no confusion or disagreement.
But there are concerns players may not report their concussions.
If I report this, then it probably is going to mean that I'm 21 days out of playing. Then they may or may not be likely to report it.
Brianna's father, Terry, would have the job of explaining the guidelines to more than 100 coaches at his local club.
It does come down to education. I think most of our coaches and managers want to make sure that their players' welfare is at the forefront.
The AIS has also recommended professional athletes not return to contact sport until they've been free of concussion symptoms for at least 10 days. That would be a big extension on the current guidelines for the country's biggest football codes, rugby league and Australian rules. A spokesman for the Australian Rugby League Commission told the ABC it's reviewing the Institute of Sport's guidelines to see how they could apply to rugby league, while the AFL is also reviewing its current concussion guidelines ahead of the 2024 season. David Mark, ABC News.